Adam Lamb, chiropractor in New York City. Today we're working on some bicipital tendonitis. So August here has a lot of shoulder pain. He's got some stuff going on right around here. It's a typical situation. You'll feel pain while moving your arm in certain directions. So what happens here is there's a little groove that the bicipital tendon sits in, and sometimes it will just slightly come out of the groove, or it'll even just get irritated within the groove, and it'll cause chronic inflammation in there. So we're gonna do a maneuver, and we're gonna try to minimize that inflammation, try to get that biceps tendon back into the groove, and then we're gonna do a few other things to help relieve inflammation and help promote healing in that area after we're done with that, okay? So the move is gonna go like this. You're gonna make a fist and you're gonna keep your arm up like this, and you are going to take your arm and go like that and bring it right back up here. So we're keeping it kind of at a horizontal parallel, and then we're going vertical like that, okay? So go ahead and do that, and while you're doing that, I'm gonna hold and I'm gonna pull back on your shoulder here, okay? So go ahead and go down and up, and I want you to go even faster and harder. I want you to actually kind of hit me when you bring your arm down like that, okay? Go ahead. Good, perfect, good. Just keep doing that, right? Okay, good, okay, and that's it. So sometimes we have to do more than that, but I already felt it move when we did that, so that was perfect. The next thing we're gonna do is we're gonna do a little bit of muscle scraping, instrument-assisted soft tissue mobilization. I like to use my 8-away tool, which adds heat and vibration to the mix. And we're gonna use that, and we're just gonna get in here and we're gonna break up some of the adhesions, some of the scar tissue. As you can see, while we're doing this, we also have a cold laser going on his shoulder to further work on reducing inflammation and aiding in tissue repair. Because what happens is when you have a lot of these chronic injuries, the body kind of gives up on it, and it just doesn't do anything. So we're coming in here and we're creating a little bit of a new injury to promote that inflammatory response again and get the body to wake up and start the healing process. Next, we're going to switch to Shockwave for this, and I'm going to start Shockwave at the lowest power available for the machine. This is also going to help stimulate the body's natural healing response. This feels okay, right? Yeah. At this level, Shockwave is not really painful. Very easy to tolerate. I'll do a little bit of this. I'm giving him about 800 shocks at this level. And when this cycle ends, we're going to now raise the power a little bit. At this power, we're gonna try to start breaking up some of that residual scar tissue as well. Okay? Okay. But also at this level, it's still not very painful, not too tender. Once we start going a little higher than this, it starts to get a little tender, and not everyone can tolerate higher levels than this. But for this application, this is about where we want to keep it anyway. So this is perfect. We're going to do a little Kinesio Tape. And I personally like this brand, Sports Tex. It's one of my favorite brands of tape, but I use many different brands from time to time. I'm going to go right where that bicipital tendon is, and we're going to come over, go over there, we're going to come right out into the shoulder, into the arm. Over that same area again. This time we're going to bring it back, and this is going to put some really nice tension on the joint and kind of hold things all together for him. We're going to try to leave that tape on for 3 to 5 days. You can get it wet, you can shower with it, and hopefully this is gonna get things to calm down for him. So I hope you enjoyed this video. If you did enjoy it, don't forget to like and follow us for more.